Now we're going to sort of walk through the steps of the CAR T process and what happens in each step and how the care partner can support the patient during this time. So, first, is there a consultation once a patient has been approved for this therapy?
Absolutely. There are several consultations. The first one, once the patient's identified by a referring physician, they will come and meet with myself and again, the coordinators and several members of that team to make sure that it seems like a good fit, that this is the right time, and identify any steps that we can take to really set that patient up for success.
Okay. And how can the care partner participate in this meeting? Are there key questions they should be asking?
Absolutely. Again, this is the beginning of the journey, and they should absolutely be there, mostly because a lot of the information, this may be the first time they're hearing, again, the words, the concepts, the timeline. So do ask about when things are going to be happening. You know, as the CAR T physician, I do this all day. So it's very clear in my mind, but until it's clear for them, again, ask more questions, ask for clarification, be clear on what resources are available. If there's something that there is a question like transportation or, sequential appointments or children in the family, all kinds of things, like really be as curious and as vocal as you're up for.
Right. Arranging for childcare and pet care is probably really important during this time. What
Exactly.
about financial planning? Is that a good time to ask about insurance and who to coordinate with there?
Absolutely. Just again, you will meet with social work, but if there are specific issues that we've already identified, specific resources, specific paperwork, we can get that started right away.
Okay, great. Okay, so then after that, once all of that has been sort of squared away and you're ready to go into the CAR T cell therapy process, there's the T cell collection, correct?
So again, to distinguish it from stem cells, I think it's important to know it is a 1 day collection for CAR T. There are no injections or other preparations ahead of time. There's no minimum number of cells that we're aiming to get. It really is a 1 day commitment to collect the cells that we collect because they'll be then engineered and modified before they're ready. And so it's not, again, the ordeal that sometimes you have to go through for stem cells.
Okay, so the care partner should just sort of be there during that time to sort of be a supportive loved one.
Exactly. And it can be a long day. You're tethered to the machine for a few hours. And when all goes well, it is an exceedingly boring experience. So be entertaining and be nearby. Uh, Always helpful.
That's great advice. So once the cells have been collected, can you walk through the next steps? I believe there are bridging treatments involved, and are those administered inpatient or outpatient?
Absolutely. Bridging therapy is the therapy the patient receives while the cells are out being manufactured. And really, the goal there is not to get rid of myeloma, it's just to prevent it from growing because myeloma that is not cared for tends to grow quite quickly. There are options to do it inpatient, to do it outpatient. There are certain therapies that would require the patients come to our center, others that are easily given with their local oncologist. So we really try to find something that the myeloma will be sensitive to and that will hopefully not be too toxic. So there's not a big recovery or a big downtime as we are preparing for the hospital stay for CAR T.
Okay. And how can care partners support the patient at home during this time? I would imagine it's sort of an anxious time.
Absolutely. Many times the bridging is something that may be familiar, like we're recycling drugs they've seen before, but these could be brand new drugs. And I think every time you're experiencing a new cocktail, there is some learning of how will you react and, the anxiety that can come with that as well. There are a few times when there are delays in the cells getting ready. So it's not a very exact day. And that waiting period, wondering, will they really come on the day they're expected, is absolutely could be an anxious time. I think keeping each other company and just actively working to be your healthiest self for whenever the CAR T is ready, and knowing that working with your physicians, we are all working behind the scenes to work to the greater success, hopefully is helpful.
Okay, that's great. And then finally, in the process, the cells are infused back into the patient. Since this is a critical time for patients, how can care partners best be prepared to help their loved one?
The most common side effects is something called CRS, which patients experience as a fever. And I think many times in blood cancers, we really worry about fevers because those could be infections. I think it's important to be prepared and expect the fever so that, again, it's not, oh no, what is this? We were waiting for it. It tends to come at a very scheduled time, dependent on the product. So just sort of reassuring, remembering, yes, there are toxicities, but they are expected, plan for them. The medical team will have an antidote, will have, steps that we take depending on what comes up. And the reason for being in the hospital is exactly to allow the medical team to respond very quickly. Most of the time, very little happens, and that is wonderful. So if anyone is feeling bored, that is great. Celebrate it with them. No news is good news during the couple weeks in the hospital.
Okay. And how long is the patient monitored for side effects in the hospital following new infusion?
So it depends on the product. Ide-cel tends to have very early reactions. And so our policy is 1 week for ide-cel and 2 weeks for cilta-cel, because there most of the side effects are around 7 days in. So we wait for the inflammation to peak and resolve. And once it's safe, we aim to get patients home. But once they leave the hospital, they should, for at least a few weeks, be very close to the CAR T center and usually require 2 to 3 visits a week for that close monitoring.